All right, so just check this out right here. This is a job listing from PG&E. You can get a job right now starting out at about $120,000 per year by only having a bachelor's degree and a few years under your belt of experience. Now, contrast this with pretty much any healthcare job. There's a huge difference here. So the huge gap here is that minimum wage is increasing, but middle class income is staying the same. And this is going to be a huge problem as inflation continues to rise, where it's just crunching the people that are in the middle class. Now, the reason I'm mentioning this is because California just passed a new law for minimum wage as a healthcare worker for $25 an hour. Now, it's not $25 an hour right now. It's supposed to go across 10 years. But the problem with this is that anybody who's middle class is going to feel the crunch. So a $25 minimum wage, that's a 39% increase in salary from what it has been. Right now, $18 an hour is the minimum wage for healthcare workers. So going from 18 to $25 an hour, that's a huge increase. Now, if I was to ask for a 39% raise, like there's no way that would happen within the next 10 years. So this is a huge problem right now. Healthcare workers are not getting paid the rate that they should be. And the main problem with this is because of inflation. And then also, if we start increasing minimum wage, it's helping the lower income, but it's not helping the middle class. And the problem with this is it's just going to increase the cost of living. It's going to increase the cost of your utility bill. It's going to increase the cost of everything pretty much. And the people that are going to suffer the most are going to be the middle class. So what does this mean for healthcare workers that are making middle class income? It pretty much means that lower class income, they're going to continue to get raises, and the middle class is not going to get any raises at all. And so if you are looking to become an occupational therapist, a physical therapist, an RN, or someone else in healthcare, you're going to just see this huge problem with not getting those inflated wages. We're going to pretty much be stagnant for at least the next 5 to 10 years. We're not going to see raises. And so I would say right now, it's not probably the best industry to start out in unless you can get some sort of per diem job, because the pay is just starting to be a lot lower than it has been in the past. And wages really aren't increasing. Right when I started out as a new grad, I made a wage increase from about $15 to $20 within just a few years. And then it kind of got stagnant. It hasn't increased at all since that time. So it went up in the beginning and now it's just plateauing. And I have a feeling it's going to be plateauing for the next 5 to 10 years. That's why you're seeing so many people right now that are striking. We just saw the huge thing in Kaiser, which was the biggest healthcare strike in history. My facility where I work at, we were going to go on strike next week until Governor Newsom passed this new legislation that said that CNAs would be making $25 an hour. I still think that there is a huge reason to strike for my profession and pretty much anyone who is working in healthcare, because the wages are just so low. Hospitals, rehab facilities, all these companies have increased their wages because of inflation, but they're not increasing their employees' compensation. They're not increasing their wages. In California, we also found out that $20 an hour is going to be the minimum wage for people that work in the fast food industry. So that is going to pretty much increase the cost of buying fast food, buying groceries. If you're buying tools at a hardware store, if you're buying groceries, if you're buying something at a restaurant, all of those costs are going to be a lot more than what they are right now. And they already are like way inflated than they were just a few years ago. And so you're going to be paying more and not be getting a raise, which I see that as a huge problem right now. Now, I've talked about California right now. What about other states? So right now, other states, they haven't increased the minimum wage as much as California has, because California is just so expensive to live here. But other states are starting to increase minimum wage just as inflation has risen. And I think they will continue to increase minimum wage. So I personally think the best way to increase your wages as a healthcare employee is just to pretty much live in a state where you don't pay state income tax, or you pay lower state income tax, and you should also just work in a state that pays more in general for healthcare. For example, this could be a state like Texas. Texas doesn't have an income tax, and they also pay their healthcare workers pretty well. So it's probably pretty comparable with what they pay healthcare workers in California. Another example would be like Nevada. Nevada doesn't have state income tax. It's probably the highest paying state for healthcare workers. Now, California is probably the worst place to live out of all of these places just because they have increased minimum wage and they're not we're pretty much getting paid in healthcare what comparable to other states, unless you live in the big cities like San Diego or LA or San Francisco. So should you still work in healthcare? Should you still get a job in this field? I think if you're really interested, you're passionate about the field, being an RN or a PT or an OT, I think it's still a good field to get into. I think there are ways around it, but I think there are some places that you should definitely avoid, and that's probably going to be like working in a state like California and trying to find a place or a city or a state that just pays way better for healthcare in general. And this may include working like a per diem position where they usually pay a little bit more. I know for example, Las Vegas, their per diem rate is way higher than a lot of other places. And so that's a good place to make a decent income, even though I know a lot of people don't want to live in Las Vegas. But even Texas, if you get a per diem job, or even if you're doing a less traditional job that pays better, like I think that could be a great idea for a way to increase your income. But I think right now more than ever is just you need to consider where you're going to be working, what places pay the best, and where you're going to be paying the least income tax. All right, guys, so share your comments below on this. What are your thoughts on the gap here with the increases in minimum wage? Leave your comments below. Please like and subscribe, and I'll see you in the next one. And I hope you have a great day. Thanks.